Now, the next type of gait that I want to talk about is called a circumduction gait. And that's seen in this GIF here. And the reason why this gait is called a circumduction gait is that essentially there is a circular movement of one of the legs of the person that's been affected. So if you can see in this following GIF here, the man is unable to walk properly with his right leg, and he's sort of moving that right leg in a semicircular manner, if you can think about it. So as you can see, he's lifting his leg and it's moving sort of, if we draw his steps here, so his left leg is moving normally like that, but his right leg is sort of trying to compensate and moving like that. So this is the circumduction part of the gait cycle. So what actually causes a circumduction gait? Well, essentially, if we have a look at this gait, we can see, or that this GIF, we can see that there is very minimal flexion of the knee occurring compared to the left leg. Because if you think about it, when you normally walk, your leg goes from that to that when you try to lift your leg upwards. But in this case, the person's leg is actually undergoing very little knee flexion. So obviously there's something wrong with the knee flexors in this case. So there is a pathology associated with these knee flexors, and in order to compensate for this weakness of these knee flexors, the person is lifting their leg to a greater extent to counteract that. And this lifting has been done by the knee flexors. Knee flexors as well as some back muscles. Sorry, what am I saying? Hip flexors as well as some back muscles. So there is weakness in the knee flexors and compensation is occurring due to the hip flexors and back muscles. So a person presenting with a circumduction gait may complain of back pain and hip pain because they've been using these muscles excessively and over a long period of time. So another key thing to remember with this type of gait is that this person may present with a lack of ability of proper dorsiflexion of their foot. And by looking at this GIF once again here, we can see that instead of a proper heel strike phase, the person sort of lands with their feet flat on the ground. So a flat foot deformity is somewhat occurring here. So in addition to weakness in the knee flexors, we may also see weakness in the dorsiflexors of the foot. And the dorsiflexors of the foot include muscles such as the tibialis anterior, various other muscles that are associated also with eversion and inversion, which can also include the fibularis longus and tertius, as well as other anterior compartment muscles such as the extensor hallucis longus, extensor digitorum longus, and muscles such as that. So as you can see, a circumduction gait can be due to pathologies or weaknesses in various different types of muscles. And this can cause for an over flexion or over essentially contraction of the hip muscles, causing for an extensive clearance of the foot off the ground, a lack of knee flexion, and a lack of dorsiflexion, which causes for the leg to be pushed out to the side and move in a sort of hemicircular or semicircular manner. So the knee moves, or the leg moves like that.